Hi everyone, this is Dr. Jeanette DeWitt and it is Facebook Live Tuesday. We are going to continue our foot health series this month, and today we are going to talk about what is the difference between Achilles tendinitis, Achilles tendinosis, and plantar fasciitis. These are three common foot and ankle injuries that I see as a chronic problem in my office. And there's a lot of confusion around what exactly these three diagnoses are. Well, first of all, let's talk about Achilles tendinitis. Tendons connect muscle to bone, and tendinitis is inflammation of the tendon. So Achilles tendinitis is inflammation of the Achilles tendon, typically around the back of the heel where that Achilles tendon attaches. Now, you can also have tendon pain in the middle portion of the tendon and even at where the muscle and the tendon combine or connect. That's called the musculotendinous junction. Typically, what I see though is that the tendinitis is occurring at its attachment site onto the back of the heel, which is the calcaneus bone. So we're going to talk a little bit technical today, but I know that you will get this because a lot of people suffer from this, or people know someone who has suffered with either Achilles tendinitis, Achilles tendinosis, and plantar fasciitis. So again, most of the time I see Achilles tendinitis at the back of the heel. And in young athletes, this is often called Seaver's disease because is pulling at the attachment site and creating like a pump bump is what they call it, a red bump at the back of the heel. And often tendinitis is caused for young children because they're changing their playing surface. They're going from a hard surface like dirt in the fall or early spring, and then switching over to a softer surface, or vice versa. They're used to a soft surface in the summer and then switch to a harder surface in the fall. So playing surface can play a factor in young children with Seaver's. In adults, what I typically see with Achilles tendinitis and that it's pulling at the attachment site is an overuse type injury where somebody increases their mileage too much with running or walking, or, for example, poor shoe wear. Somebody's walking around at the amusement park for 4 or 5 miles in the course of a day in flip-flops. And both of these issues, increasing mileage, increasing activity level, shoe wear, and firm surfaces, actually 4 factors, can contribute to Achilles tendinitis, Achilles tendinosis, and plantar fasciitis. Going back to Achilles tendinitis, this is definitely a more inflamed condition. The tendon is inflamed. You may see redness in the area. You may see swelling in the area. It can be painful to touch. The other thing that can develop is a bone spur and calcification, or the body's response to a stressful area. It's laying down bone or calcifying or creating that bone spur in the area of stress. When this happens, there's quite more irritation, and for the back of the heel, a lot of people won't tolerate wearing a shoe with a heel back to it. They will prefer a flip-flop or a sandal, something that is not rubbing against the inflamed area. Now, the reason that this tendon becomes inflamed is because, like I said, there's a sudden increase in activity. There actually is a bone spur present and causing the irritation. And oftentimes, Achilles tendinitis is caused by tight calf muscles. So the treatment is often the Price mechanism, or rest, pressure or compression, rest, ice, a reduction in activity, and elevation to help with the swelling. So that Price principle, which I've talked about in other Facebook messages, I've talked about that being what you would do in an inflamed condition. That pressure, rest, ice, compression, elevation, or protect, rest, ice, compression, elevation. Now, treatment will include that PRICE mechanism or that PRICE acronym, but there may also need to be a reduction in activity. If it's severe enough, the physician may need to be involved in prescribing NSAIDs or anti-inflammatories. Physical therapy can help to reduce the inflammation, as well as create an exercise program to help with flexibility of the calf muscle, as well as creating better balance and strength of the lower leg muscles or even hip muscles, because sometimes the foot is stressed because other parts of the body, such as the hip and the back, are not strong enough, and the foot is taking the brunt of the load. Just so you know, Achilles tendinitis can take 3 to 6 months to heal completely. There's not really a quick fix to Achilles tendinitis other than making sure you reduce the inflammation, making sure that you resolve the root cause of a problem. So if somebody is running or exercising and they've doubled their activity, we need to stream back that activity or have a period of no activity that might provoke the symptoms. So I actually don't see a lot of people kind of shut down completely from full exercise with Achilles tendinitis. It might be more of a few days off to give it some rest, or cross-training in a non-provoking way. For example, for a runner, they might do water running, or they might do the elliptical, or they might do the bicycle. So they can stay active, they just don't want to put all the pounding forces that potentially cause the problem in the first place. Let's go ahead and talk a little bit about Achilles tendinosis, because Achilles tendinitis and Achilles tendinosis, they are treated very differently. And often I see people diagnosed with Achilles tendinitis when actually they have Achilles tendinosis. And what happens is sometimes they go ahead and self-treat themselves for Achilles tendinitis, and they're stretching and stretching and stretching, but they actually have Achilles tendinosis, and all of that stretching can actually pull and create more of an irritant. Not saying that you don't stretch with Achilles tendinosis, but sometimes if you're overstretching, it can result in further pain and discomfort. Now, Achilles tendinosis is inflammation of the Achilles tendon, but the inflammatory stage of healing has basically shut down, and now that tendon is starting to become fibrotic, and there's some degeneration of that tendon occurring. So you don't always see the inflammation or the redness present. You see the aftermath of the Achilles tendinitis, where you might have that pump bump or that swollen area on the back of the heel, but it's not really increasing in the inflammation or swelling, and it's not really decreasing. It's just very painful. And this is usually happening when a person does not take precautionary measures when they first start to feel the symptoms come on with Achilles tendinitis. So it becomes a chronic condition now, develops into tendinosis, where there's a fibrotic tissue development and a scar tissue development within the tendon, and the inflammatory process has stopped. Now, the treatment for this is actually to stimulate inflammatory response again. There's a lot of misconceptions about inflammation. Oh, we can't have any inflammation, but the body actually needs inflammation to heal itself. And when that inflammatory stage stops, it can't bring nutrients and it can't get rid of waste products in the area, so it kind of just sticks around. Well, when we have treatment for tendinosis, we actually stimulate an inflammatory response, which is not always comfortable. However, when we stimulate that response, we start to get more healing again, and the person can start to fully recover from that Achilles tendinosis. Some of the things that cause the tendinosis are similar to what causes tendinitis. It can be calf tightness, tendon tightness, a bone spur at the attachment. And again, this could have initiated because of what caused the Achilles tendinitis and increasing activity too quickly or having tight muscles. So with Achilles tendinosis, that inflammation has kind of become fibrotic, and we need to create better tendon gliding, and that requires the skilled work of a physical therapist or a certified athletic trainer to help manually move the tendon in its sheath. And let me explain this way. So if you have a sheath of tissue and the tendon is sliding through, what happens when that tendon is fibrotic is it gets stuck. And when that gets stuck, the tendon no longer glides and stretches or shortens and elongates because it's stuck in that tendon sheath. So you actually need someone who will go in and start to mobilize the tendon and create better tendon gliding. And then you also need a type of technique called instrument-assisted soft tissue mobilization. And this is where I actually will use tools such as this to, it looks like I'm scraping along the tendon, but I'm actually creating an inflammatory response, and I'm reducing any restrictions that might be occurring in the tendon itself or in the muscle. So if I use my hand here, I'm basically pulling like this. Again, it looks like I'm scraping, but it's really more of a fanning approach. And again, this is not very comfortable initially, but the patient will start to see signs of improvement as that healing process begins to take place again. Now, the treatment for this is, like I said, I do that instrument-assisted soft tissue mobilization. I do some tendon gliding, do some gentle stretching, but what I can also do is a specific strengthening program. And this involves what we call eccentric strengthening of the calf muscles. And eccentric strengthening involves a deceleration type of strengthening of the muscle. This is a little bit of a tougher type of workout, but it helps with the healing process, and research shows that is the most effective. The research protocol that's used takes about 12 weeks. So again, this is not a quick fix type treatment. It's going to take a good 12 weeks or 3 to 6 months for complete healing to take place. Now, what we go and we want to take a look at is, with physical therapy, we have the manual work with the tendon gliding, we have the instrument-assisted soft tissue mobilization, we can also use some ultrasound to help with tissue healing, we can help to improve flexibility, we can use, sometimes we can use electrical stimulation. That's not as effective as the other techniques, but if there's inflammation present and pain present, electrical stimulation and ice can help reduce those. The other thing that you can do as far as treatment would be more of a physician intervention, which is PRP injections or protein-rich plasma injections. Those have proven to be effective. In severe cases, sometimes people have to be prescribed the use of a walking boot to take pressure off of the Achilles tendon itself. And then in very severe cases where all of these conservative treatments haven't been effective, surgery can be warranted. And the surgery rates, it can be proven based on the evidence that I've looked at, about 80 to 90% effective, because if there's a bone spur that's present, then that surgery goes in and it removes the bone spur, removes that source of irritation, and then physical therapy is often warranted afterwards to continue with the healing process. Again, this is going to take more than 6 months to heal, especially if a surgery is involved. So that's the difference between Achilles tendinitis and Achilles tendinosis. What about plantar fasciitis? We are approaching the spring and summer, so as I mentioned last week, the worst shoes to wear when walking for long periods of time are flip-flops, but I will see this, and then usually August or September, I see kind of an influx of plantar fasciitis issues. So please don't be one of those people who wear flip-flops all year or all summer long and then has a problem in the fall. I'm trying to stave that off by preventing that from happening for you. Now, plantar fasciitis, this is inflammation of the plantar fascia, and the plantar fascia is that band of tissue on the bottom of your arch or in the arch of your foot. And this tissue starts at the heel and it actually goes up to the ball of your foot. So it's a very long type of tissue, and it can get restricted or shortened or tight through any stage of that arch. So some people will feel it as heel pain, some people will feel it as arch pain. The classic symptom for plantar fasciitis is when you've been sitting for a long period of time, or when you've been sleeping and that first step in the morning, you get out of bed and your heel, like you feel like you're gonna fall over. It's so excruciating. And then as you start to walk a little bit, it loosens up and then it starts to feel better. That's the classic sign for plantar fasciitis. Now, the cause of plantar fasciitis is actually unknown, but there are certain factors that increase your risk of getting plantar fasciitis. One of those factors is age. So typically plantar fasciitis can occur between the ages of 40 to 60. And certain types of exercise also can be a factor in creating plantar fasciitis. For example, the long distance runner, ballistic jumping, that means like bouncing type movements, ballet dancing, and aerobic dance. So the reason that ballet dancing can create plantar fasciitis is probably due to the barefoot position of ballet or the lack of real support in ballet shoes. And aerobic dancing is another one, because especially if there's a step involved. Sometimes people wear running shoes for aerobics. Running shoes are not the best shoe. You really need an aerobic shoe or a cross trainer type shoe to perform aerobic dancing. These type of factors can influence plantar fasciitis, as well as foot mechanics. People who are either flat-footed or very high-arched tend to be more at risk for plantar fasciitis. Obesity is another factor. If you weigh more, you're putting more weight on your feet. I like to tell people who are trying to lose weight, for every pound of that you lose, you actually lose 3 pounds of force off of your body. So for example, if somebody has 100 pounds to lose, they are actually putting 300 pounds of extra force on their body. So in the terms of weight loss though, just think that if you lose 10 pounds, you've actually lost 30 pounds of force off your body. So it's not so daunting of a task if you go incrementally and think in those terms. But obesity can be a major factor in plantar fasciitis. The last major factor is occupation. So if you stand on your feet a lot or have to walk a lot for your job, you know, think of the cashier at a store. A surgeon can be at risk for plantar fasciitis during the long days of performing surgery and kind of bending forward and leaning over. And nurses, any health field or service field that is going to require someone to be standing or walking on their feet chronically through the day, that can be a contributor to plantar fasciitis as well. As I said, the classic sign of plantar fasciitis is that heel pain with the first step after prolonged sitting or after sleeping. It tends to be worse after inactivity, and it tends to get better with exercise or moving around. The treatment for plantar fasciitis is rest, ice, stretching. Sometimes there's NSAIDs involved or anti-inflammatories prescribed by a physician, physical therapy to correct any inflexibility to help restore strength and create better balance between the front and back lower leg muscles. And then also night splints can be a factor in helping to promote a low load prolonged stretch during the evening while you're sleeping to help increase the flexibility. The other thing, if somebody has flat feet or has really high arches, an orthotic can be helpful, as well as like a heel cup can be helpful to provide a little extra cushion to the heel. These are the differences between Achilles tendinitis, Achilles tendinosis, and plantar fasciitis. If you are suffering from any of these and have questions, I encourage you to contact me directly at 262-842-2220. I'd be happy to answer your questions and guide you along. You can also visit my website at www.dewittptwellness.com, or you can email me at jeanette@dewittptwellness.com. Thank you so much. I hope this has been informative to you. Again, my name is Dr. Jeanette DeWitt, and I'm a physical therapist, an athletic trainer, and a fitness coach. And I'm happy to answer any questions that you have. Thank you so much, and have a wonderful day.